She had a secure government job in the UK, 10 years with the NHS, a life most people dream of and never leave. But she chose to come back, not for comfort, not for convenience, but to build something India desperately needed. Over the years, she's received multiple accolades for her work in this field. But the one closest to her heart is the national award she received in 2017 when she was nominated by one of her patients. Today, my guest is Dr. Puneet Rana Arora, an NHS-trained infertility specialist, fellow of the Royal College in the UK, and the founder of CIFAR. In the last 5 years alone, her work has helped thousands of couples experience a moment of happiness. But this conversation, it's not just about IVF. It's about care, ethics, stigma, science, and the emotional weight of holding someone's hope in your hands. Welcome to the JOAAT-Cast.
A very warm welcome.
Thank you.
Government job in the UK. फिर इंडिया आने का क्या सोचा आपने?
So, this decision, Rahul, after marriage and after having kids, this was taken.
Okay.
Obviously, we left India when we were 2, and we left UK when we were 4.
Sorry. 2 and 4?
So me and my husband went. We came back with
Janice.
2 boys. Yes.
Okay, so that's how it happened.
After you have a family, the decisions sometimes are not just yours, they're decisions for the family you take. I would say that, it was lovely experience learning and growing in UK.
Yeah.
But my husband had a different focus, and the specialty he looks after is pediatric oncology.
Pediatric oncology.
So it is looking for children with cancer.
Oh, very specific.
Very specific.
Yeah. We will have a lot of discussions about medical terms, so please be ready and brace up for it. I will try to put as many explanations as I can as we move along.
The way the Western world was doing in oncology at that time, he wanted to bring back to India. So that was the push, because it was for a noble reason. It was a noble cause. So we all agreed on it, and we decided to move back.
Right. How old were your kids then?
So my elder one was 7, and
okay.
my younger one was 3 years when we moved back.
Right. So 2 से 4 हो गया, वापस आ गए.
वापस आ गए, हाँ जी.
Okay. I think that's a very noble thought that he had. What's his name?
He is Ramandeep Singh Arora.
Dr. Ramandeep Singh Arora. And you are Dr. Puneet Rana Arora. What's the
right.
story of the Rana there?
So Rana is my maiden name.
Okay.
And Arora is my married name.
All right.
And Puneet is me. Yeah.
Right.
So I wanted to keep my maiden name with me because there are a lot of memories I have of my childhood. I didn't want to lose it. So I've thought of keeping my maiden name as my middle name.
Right.
So
where were you born and brought up?
I was born in Ludhiana, Punjab.
Okay. Ludhiana di kudi hai, sutta wala shehar.
Textiles, yes, garments and hosieries, and yes. But I grew up in Rajasthan because my dad's business was there. So I belonged to a business class family. My mother was a music teacher.
Nobody was doctor in the family?
Nobody was a doctor.
Okay.
But my mother had a strong desire to be a doctor. And the year she was supposed to appear for the interview, something happened and her interviews got cancelled. And it moved on to next year. And her father was not keen to have her or give her a break here to pursue medicine. I think that's the desire she saw in us, in me. And I think it was her hard work which really pushed us to be here where we are.
Nice. So, आंटी जी क्या नाम है उनका?
अजीत.
So, अजीत कौर जी, बहुत धन्यवाद कि आपने ये प्रोडक्ट क्रिएट किया है दुनिया के लिए, because she has taken up something very, very specific. That is exactly what we're going to talk about next as well. Right. So, that's where the inspiration came. In a way, your mother sort of asked you कि you should become a doctor. Eventually, it's our decisions, right?
No, I would agree. I think it was not a push, to be honest, to come to medicine. I think in our times, there were 2 specialities. या engineer ban jao, या doctor ban jao, right?
So
that
true, so
time,
true.
that time it
Actually.
was there. So when the time came to select my subjects, because my elder sister is also a doctor,
Ah.
so it was coming in the family.
Mhm.
And okay, biology was something I thought maybe a little easier. I was a little naughty that way because my sister will give me bani banai khichdi types. I thought it'll be relatively easy.
पर्रे use करें हैं आपने
Parrish करे
sister
हैं
के?
हाँ जी. And but that time tech was coming up,
हाँ.
computers, and that used to fascinate me a lot. I had always seen a handwritten prescription of doctors, which was very difficult to read.
Right, handwriting of doctors,
And of
है ना? It's so
doctors.
interesting.
So what I had in mind was to use that tech to make some prescription or something as a more neat, legible way, where patients don't suffer or the pharmacists don't suffer because they are not being able to read doctors' handwriting. So that kind of stimulated me to take computers and tech, and that's why I didn't leave maths as my subject and physics as my subject.
In 12th, 11th,
in
12th.
11th, 12th. I
So you were medical plus non-medical.
plus
तब तक decide नहीं किया?
नहीं किया था because I was not. Yes, from home it was like medical, but my inner instinct was to do something different in tech. And then the time came when we appeared for our entrance exams. The first entrance exam which comes over the year is for non-medical entrance. I got selected in the central entrance.
Nice.
But my number and ranking was that I was getting architecture and not the tech specialties. But then because I had medicine, I thought of giving that entrance as well. And I scored amazingly well in that. In one of the top rankings. So that I think gave me a little insight. Maybe is this something for me? Because I think I have an aptitude to take medicine. So my options ahead were either to pick up medicine or to give again like a break here and apply again and go into the tech specialty. But I think it was like a joint decision with the family. That's how I came into medicine.
Brilliant story there. At that time, we didn't have any other option. Parents had just framed this that doctors or engineers is the only way to,
And I think the way, because now I see my children taking the specialities, I feel the way they have their counseling sessions and all, we never had that.
MBBS is standard. People can become general physicians. You could have done anything else. But you went to the UK and you specialized in something very, very specific, right? I mean, infertility, reproductive systems, treatments, etc. And we'll get into all of those. खूब सारे notes लेके आया हूँ because medical terminology, yeah. You did MS at Sardar Patel Medical College. That was during the time your father was there doing business and all of that, right? That's Bikaner?
I did want to move out of Rajasthan, but Bikaner was very close to where I belonged to. I think in those days, being a female, child and little bit we were in a close-knit environment.
More protected.
More protective environment. And when I got an opportunity to study there, I think I was very happy. I was very happy to be there.
5 years there.
Yeah.
Then how did this thought of going to UK come about?
Once you go into a specialty, you have a desire to learn more. What's happening in the world? You read publications, all the publications from overseas. At that time, not many were coming from India. You're reading literature from UK, USA, Europe. So I just wanted to see, you're reading, but how does system work there? I was just intrigued by the knowledge which was in literature, medical knowledge from these outside world. And at that point of time, I managed to meet my husband. We met in Delhi.
In Delhi?
He was studying in Delhi then.
Delhi क्या करने आए थे आप?
My sister got posted from Andaman Nicobar to Delhi. I used to come from Bikaner and visit her.
Was he the one who showed the intent?
No, I think we both. We did manage to spend time together for a lot of months before we finally got married. Kind of introduced as an arranged. I loved that bit because I don't think so I had a confidence to select my life partner, to be honest. Because we were so much into studies and, trying to acquire knowledge, work non-stop hours. I don't think so I had that, kind of courage to say or say yes to anybody. Yes.
Time nahi tha. You had so much studies going on.
Maybe, yeah, that's the right. You're making me reflect now. Yeah, you're right.
Is it?
Time nahi tha.
I'm making a doctor reflect. How did this thought of care come up in your mind?
Empathetic, sympathetic, I've always been there. That's the feedback I used to get from my parents, from my friends,
Mhm.
from my other family members. I used to hear a lot, you're very gentle, you speak
Mhm.
very politely.
Yeah,
But I think when you go out and meet a lot of people, then, I came to know that I am really
meant for it.
meant for it. So I've always been caring, but I think when I took medicine, which obviously happened a little bit as a default sometimes, I feel, but when I went into it, I just loved this specialty, and I wanted to
Found your
just
spark.
in it, and just wanted to grow in it.
You got married and then you went to UK?
My husband went before me. I was still giving my exams
You were
of my
still finishing your
post graduation.
okay.
Yeah, and then we got married.
You did a postgrad after this Bikaner college.
That's
Where did
right.
you do that from?
The MBBS is from medical college. The post graduation we do in the hospital based
Okay.
settings, which is a PBM hospital
Like a
of Bikaner.
resident
That's
doctor.
right. That
Okay.
resident doctor. Yeah.
Your husband first went
Was
after marriage.
after marriage. No, before marriage.
Before marriage.
Got
But
married.
तुम्हारी गलबात हो गई सी
हाँ जी,
उस
हाँ
time
जी,
तक?
बिल्कुल,
अच्छा, okay.
बिल्कुल, बिल्कुल.
Okay.
We are all,
So you had
we were all
decided
set
and
up.
all set up
Yeah,
to
yeah,
kind
yeah,
of.
yeah. And I visited him, he visited me.
नहीं,
before
risk रहेगा ना
marriage.
मैम, उधर
हाँ.
कोई गोरी मेम पसंद आ जाए फिर उसके बाद.
नहीं, नहीं.
So
I know him now. That's what I'm saying.
so you kind of got engaged and then
Then he
He
went
went.
there, and then we got married later once I finished my post graduation.
So there was it his influence of calling you over?
Not exactly. I think we both, when we met, that was one of the.
You planned it.
Yes, we planned it that time to explore, study, gain more knowledge that we had in common. And I think that's why we just carried on together and planned to get married, because we had a lot of things in common. And one of them was, to pursue and have knowledge outside as well. Yeah.
What is this MRCOG?
So this is the membership of the Royal College of Obs and Gynae. I am now a fellow, which is above the member. So now I am FRCOG. It means that it is given to someone with number of years of experience.
Yeah.
So, I am in that category where I have a reasonable number of experience, and that has been testified by the Royal College
Kind of a certification
from London, Obs and Gynae.
Wow.
MRCOG I got when I was there in 2004 or 5, I think I got that.
Okay.
And in 2020, I got FRCOG.
What made you think of specifically choosing a master's in reproduction and development? Because you did that at Bristol, right? University of Bristol.
That's right. It's a very interesting journey for me. When we study obstetrics and gynecology, obstetrics is studying about delivering babies and doing it. Gynecology is dealing with all female health issues, right? So there are a lot of aspects of gynecology, like, gynecology oncology, which is dealing with cancers in women, gynecology urology, like dealing with problems with bladder for women. Then it is one of the other things is reproduction and development. It's my being in UK helped me to kind of think about this specialty a little bit more. I used to always get fascinated by this small, egg and sperm, how they fertilize and
Two cells in a way, creating a whole human being.
But I used to get worried and scared that how can it happen? It's just not possible because nobody has seen it. We study it, right? But when I went to UK, I had a chance to be in the lab, do some research. And that's the time when I really got passionate about this specialty and says that, this is something, a miraculous thing. This is making a change in someone's life dramatically and drastically. And it's a happiness which comes along with it that keeps you going. Because there are some specialities in medicine where, because I did gynae oncology, everything there in UK, because the way the UK training works is you get exposed to all specialities of gynecology.
Then you choose.
So I think that was the beauty there, that I could spend time in different specialities. But what I found more, the happy specialty was this specialty. But yes, it has its own challenges. But that gave me a kick, and I just wanted to carry it forward.
So 4,400?
I think it's 4,425.
4,425 positive results for parents, positive pregnancies is what CIFAR has so far achieved. Thank you for you choosing that particular specialty as well for women. NHS is the National Health Institute in the UK. ये एक तरह की सरकारी नौकरी थी. So Dr. Raman and Dr. Puneet both were working in the UK for 10 years, and then they decided to come back to India. Why did you decide to come back? You mentioned a little bit about it, your husband's vision for India. Was it that only he was deciding कि मतलब आपका भी opinion था ना उसमें?
The start of the discussion happened with Raman. Then when the conclusion happened, obviously with me. being
After marriage,
agreed.
that's the case, right?
Yes. And it's better be the case to have a happy family.
Finally approved by Dr. Puneet.
That's right.
That's how I will put it.
That's right.
At the end of it, you were kind of starting your own company. Was that the eventual goal when you came back?
No, never, I would say. I was very much an NHS person working 9 to 5 kind of a thing. Never thought of doing on my own. But I think the journey in India kind of made me think about CIFAR.
ऐसा क्या हुआ? Was there a particular instance? Was it the care that you saw in India that people are kind of taking or giving? Was it any different than what you saw in the UK?
So what happens in India is that there was not a concept of a reproductive medicine as such subspecialty that time.
Okay.
It was more obs and gynae. Obviously, it's a subspecialty of that only, but it was mainly obs and gynae. So that time when I came back, I was clear that because, I mean, in UK also, I stopped practicing obstetrics. I stopped practicing all aspects of gynae except reproductive medicine. So I completely branched and dived into it because then only you can focus and give your best. When I came back, I met some people who were already doing a bit of it. They discouraged me to not to take it as its own specialty, but I should rather be a general obs and gynae here.
Gynecologist बन जाओ, business ज़्यादा है उसमें, है ना?
Correct. And side by side, do what you're doing. I think I was very firm in that decision because, like I said, that specialty gave me a kick. That had something which I felt need to be delivered to our patients because this specialty is something which has a lot of stigma also, Rahul.
I agree.
And that I felt coming back to India. Few hospitals which were coming up offering just this specialty. I think it was just building up. So I joined a couple of them initially with them.
A lot of IVF centers
That's
in
right.
India,
Yeah.
Is there a difference in what you envisioned or what you saw in the UK versus what you saw in these centers in India?
Yeah.
That then guided you towards opening CIFAR?
Yes, definitely. I think that's what, like I said, I was a person of 9 to 5, work, be with your patients, be with your family in the evening. So I've been very much like that.
So let's talk about this gap that you saw as well. I mean, you worked with a lot of reputed names in India.
First of all, it was an amazing experience working with all of them because that gave me insight as to how it works. Otherwise, CIFAR would have never come if I would not have worked in those hospitals. So it was a very good learning experience. Some of them were very good. But what I felt was that the patient-centric approach and the research bit was lacking in all of them.
The care. That
care.
Dr. Puneet defines in a way, right? So that wasn't there, is what you're saying. That was missing.
I felt that was missing. That kind of led me to a thought where that's why CIFAR stands for Center for Infertility and Assisted Reproduction. So it's a center which is obviously offering not only excellence, but also we have a research wing where we keep on, analyzing our data and publishing it.
So you are publishing your findings without
right.
obviously compromising the privacy of the patients,
That's
but
right.
You're publishing your findings so that others can also kind of learn from it. Isn't there already like a knowledge bank for a lot of countries created by the UK itself, I believe, for
UK,
doctors
USA,
and medicine?
that's right. They have created, but they have their own data. So what we try to do is publish our own data. So that because somewhere down the line, our population is different from their population.
So 4,425 positive pregnancies learnings to continue improving the whole situation in India is what you're helping with as well.
That's right.
Brilliant. Any specific moment when you really knew कि भाई अब तो मुझे खुद अपना ही कुछ खोलना है?
I would say working in one of the hospitals was not a very good experience. And when it got shut down, I felt that the patients were not in the picture when they took that decision to shut it down.
They didn't plan for
They
them.
didn't plan for them, and that was the main driving force, that it's somebody else making those decisions.
When people embark on this IVF journey,
That's right.
it is a long drawn process. It can take years.
Absolutely.
Right.
So I felt that doctor-led center is something which I think a doctor and a patient can understand this relationship, and this kind of a hardship which the patient goes through in this journey. So that's why the decision was that its time has come.
Care.
Maybe
Care
yes,
has to
the
be brought
care
in.
has to be brought in. Yes.
Brilliant. That's a great thought. When you opened CIFAR, what is it that you bring differently in the market?
So it is a reproductive care. We deal both with, obviously, gynecology. Like I said, it's a female specialty. But when we branch out into reproductive health, we learn about both male and female reproductive health.
Okay.
So we offer to both, because what I saw the gap when I came into India also was the fact that it was always put down to a female problem.
Belief.
Belief, right?
लड़की की वजह से ही होगा.
Correct. So we wanted to break that myth. So we have opened our center also for male reproductive health issues. So we actively encourage male partners to speak about it, and that we mainly do by starting our sessions with a counseling session. I feel that psychological counseling by a non-medical person helps our patients to open up immensely.
So you start with counseling, guiding and informing in a way कि भैया it could be a male problem also, it could be a female problem also. ऐसा नहीं है कि सिर्फ लड़की पे डाल दो.
Absolutely.
Right. So that's the differentiator, one of the differentiators.
IVF stands for in vitro fertilization.
Right.
So, the way a human is formed is through fertilization of an egg from mother, oocyte, what we call in medical terms, and sperm from the male husband. So this fertilization happens in the fallopian tube, which is a part of the female reproductive system, right? So when this fertilization happens outside, it is in vitro. And that's why sometimes these procedures initially were called as test tube babies also. The journey started with the women who had abnormal or damaged fallopian tubes. There was no other way she could have got pregnant. The fertilization happens only in the fallopian tube. And if a woman's fallopian tube is damaged, then there is no way she can get pregnant. So that's where it all started.
That's why it was called test tube babies also.
But now it's been used for various other reasons as well, and that's why we kind of don't no longer use it as a test tube baby. It is an in vitro fertilization, or what we call as assisted reproduction techniques overall.
And that's what CIFAR
specializes in.
How long should people wait for before seeking counseling or guidance?
So generally, if we say that if a couple is trying very regularly and religiously, it can take a max of 1 year to get pregnancy and conception. But if it goes beyond that, then you should kind of speak about it and seek help. You should not leave it longer, because sometimes there are very subtle things which can be corrected by medicines only. But leaving them doesn't help.
So they should then not immediately run to the for IVF, but they should at least check with a specialist.
Absolutely, because we do all kind of stuff. We also offer medical treatment. Our medical treatment success rate. So when you see this number of pregnancies, it's not IVF.
Not only IVF.
It's everything we offer, including from medical management to IUIs to IVFs.
So let's say that a couple has realized that this is what is going on with them. It's been a year, or let's say 2 years, or maybe let's say 3 years, because generally speaking, in India, people will keep the faith. Pehle, Vaid Hakim ke paas jayenge, I'm sure. You must experience that, right?
Yes.
And then they will come to a doctor, right?
That's right. In India, it is still believed that the general gynecologist, are the first port of call for these patients. The awareness about reproductive health specialists is still a little different, because I think there's a myth that these centers just offer IVF, and this is not the case. IVF is one of
CIFAR also helps guiding you, counseling you.
counseling.
Counseling से भी हो सकता है that you are successful,
Absolutely,
or maybe some
absolutely.
medication से भी हो सकता है.
Absolutely.
You don't have to get to the stage of
Stage of
IVF.
IVF.
You just have to become aware, right?
Absolutely.
But I think there's also this associated stigma. Is the age a factor as well, and how we have changed our lifestyle a factor as well when this
Yes.
happens?
So age of the female partner is very important. So when I spoke about 1 year of trying, if the age of female partner is more than 35 years, I think it's better to seek help after
Before.
6 months of
6
trying,
months.
not wait for 1 year, because we know age is a very important independent factor
So
for
up
pregnancy.
to 35 years,
1 year.
1 year में अगर you're not successful in having a successful pregnancy naturally, then you should seek help, consulting. Doesn't mean IVF only, by the way. But if your age is above 35, you should seek it if you're not successful within 6 months.
That's right. Yes.
Instance of not having a successful pregnancy naturally, is it increasing in India?
So I would say it's both ways. Yes, our lifestyle of not sleeping well in the night, having a lot of stress.
Stress also matters.
Stress really impacts. That's why CIFAR really believes in that counseling. Start every session with a counseling, because we try to gauge and see their stress levels, anxiety levels, depression levels.
What are the key factors? Let's say you have to name top 5 key factors.
So I would say stress, anxiety is the number one. Number two, the way the lifestyle, the work pattern, because a lot of our couples are working with MNCs. So their pattern of working is they work in the night, they sleep in the day. So that rhythm pattern is going
if
away.
You're kind of completely shifting your sleep patterns.
Right? That could be number two. Number three is a lot of times I have seen that in my center, they are living also in different cities because of the work
Partners are living
commitments.
apart.
Apart.
Acha. Oh.
So they just come on those good days, they meet, right? But that sometimes doesn't help. So I think it's just again, that may come down to our lifestyle only, that we are living in apart because of our work schedule or whatever reason it is. So that's number three. Number four is we are leaving it too late, because there is an ideal reproductive age for especially for a female partner. So generally we say like from 24 years to 34 years.
24 to 34 is the ideal reproductive age otherwise for women. Okay.
And we nowadays see in our OPDs the age is shifting away to more than 35.
So late marriages are
Late
contributing to it.
marriages and not thinking about pregnancy at the right time are these
I will just mention categorically outright here. These are only our opinions,
Yes.
right? They may be different for you. And I've seen stories of people conceiving at 38 naturally as well.
Absolutely.
Totally
Yes.
depends on your body. But these are some of the factors, top 5 factors.
True.
Some people say laptop बहुत ज़्यादा काम करके या
That's right. I think these are all the radiations, the waves which come in. No hardcore studies, but again, there have been few mentions about if these waves affecting the semen counts, and there are always a mixed pattern of studies which come on these data. But I would imagine
somebody
that
might have done a doctorate somewhere on a thesis, but
yes.
you never know.
Yes.
These are our opinions, and but she is an expert in this field, so they're important opinions when they come from her. What about smoking, by the way? You mentioned factors, but you didn't say smoking.
Yeah, smoking is an important factor as well.
Yeah.
Smoking, alcohol. I think more than alcohol, it's smoking, which does it's a chronic changes. It leaves with the cells of the body, and sperms and eggs are like cells of the body. So, and no medications or antioxidants can cure this inflammation which is caused by smoking. So smoking
female
is bad.
or male,
Both.
irrespective, है ना?
Even, I mean, again, there's a talk about whether it's only active smoking or it's passive smoking. So I think passive smoking also is equally bad.
So all this
as
pollution
absolutely
also is kind of
contribute to that. Yeah.
These are the 5 or 6 factors that primarily you feel
they have changed over years, and they have led to change in the type of patients we see, and also our results sometimes also.
So let's say people have figured this out. Could be any of these reasons. And what is it that CIFAR's first step will be?
We have a couple of questionnaires which are which have been designed also and modified by us also, and internationally accepted and nationally accepted as well. So we come to know their level of, all this anxiety, stress, and everything, and we guide them to a dedicated counselor in case need be. Next step is they undergo a thorough medical assessment. Then they're seen by doctors.
So like medical assessment, sort of like blood test and all those deep
history
dive
taking,
history.
blood test, all that stuff, anything which can lead us to the reason of not achieving conception. Like I said, IVF, in vitro fertilization, is one aspect, but we try to go deep into the history taking and any modifiable factors which we can see, which can just give them spontaneous and natural
Results.
conceptions result.
What could come up in a blood report of a person, for example,
So the blood
that they might not
reports.
be aware of?
So the blood reports may tell us about women's ovarian reserve, right? The number of like good quality oocytes left in the ovary, any thyroid dysfunction,
Can also be a factor
a
in the
factor in this uncontrolled thyroid, I would say, and sugar. The HbA1c and the sugar
Can also-
values can also affect the
a lot of factors.
yeah.
Right. So then, so you've done these tests and counseling's done. Then the tests are done, and
then a plan of management is made as to whether they will try with medical management, or there is a assisted procedure called as IUI, which is
IUI.
intrauterine insemination, or they would go ahead with IVF.
Okay. So these are the different procedures available with you, and then more advanced after that.
More advanced. And we also do the endoscopy surgeries, what we call as laparoscopy and hysteroscopies, because what happens sometimes is the reproductive organs may just have small adhesions or small cysts. So we try to remove them. Again, this is only for optimizing and giving them a natural
Better
chance. We monitor them for 3-6 months. And if they're not being
So you're
able
trying this in the 3-6 all this
months.
if the couple decides.
If they decide, obviously it's a very informed consent. It's a very not a very formal counsel, very informal counseling, and we are very open what they think, we tell them what exactly we could see in
They
their
need.
blood reports and all, and what they need, and then they make an informed consent whether they would like to go with it, or they just would like to just wait still and do it naturally, more naturally, without any assistance. So we give them a choice. In case they wish to follow us, then we try to follow with a particular medication or a protocol for 3-6 months.
Okay.
Because we generally believe that it does bring in results in
So you're
3-6 months.
saying-
Any one particular option brings in results within 3-6 months.
So you're saying maybe it's just multivitamins are not there, the person doesn't diet is a problem.
Absolutely. Diet, like you said, sitting, or maybe work related.
Exercise nahi karte hain.
Exercise nahi
Does that also
karte.
contribute?
Again, it's the sedentary lifestyle, prolonged sitting. Is it because of the work or exercise nahi karte hain? वो बात एक ही है. So these things, I think what is important is the vascularity of the body has to go on. And sedentary lifestyles, cut away that vascularity, and you have problems then in conception. Yeah. Too much medical terms, I think.
That's okay. That's what it is for as well. I mean, because I'm sure that a lot of people will find insights. कई लोग सवाल पूछना नहीं चाहते, जानते नहीं हैं, या फिर शायद they just feel that it will happen for them gradually. So how much is too late, right? So okay, so a lot of processes and procedures, and the IVF process then is kind of the last stage in a way. मतलब बहुत सारे और तरीके हैं बीच में.
Correct. Absolutely.
And all of that also CIFAR does. Not just IVF center.
Not just
IVF center नहीं बोलना चाहिए.
Correct. It's a fertility center.
Yeah.
It's a fertility, because we look at the
could happen with counseling
also.
Age is an important factor. Are you saying younger people, you don't see the instances of not conceiving in the younger people?
No, I would not say that. With age, the reason for infertility or subfertility is because of exhaustion of good quality eggs and decrease in ovarian reserve. The younger patient may have a different reason. They may not have this reason.
Could
they
be
may
some
have,
of the medical things that
absolutely, they may have some cysts like endometriosis, or they may have fibroids, or they may have a problem what we called as PCOS, where the eggs don't mature. So maybe, still they can have an issue, but the reason for the problem could be something else.
In your opinion, what is the biggest misconception that couples in India have about fertility or infertility?
Initially, when I came, I felt that the male partners were not actively, involved in the overall assessment.
हम ठीक हैं. It's a female problem.
Female problem.
That
And
is.
when you ask them to do analysis, they may take time to give samples and all.
सोचना पड़ रहा है.
सोचना पड़ रहा है. So I think that is changing now. In fact, some of the male partners are coming themselves first. I think with awareness and education, this is changing. They first come in to make sure that they are not affected before they start assessing their viability. So it's changing. So I think that's where I feel that we have won over the last 8-10 years, that this awareness has definitely gone better.
What are the other misconceptions that might be there?
So one of the misconceptions is that these centers, reproductive health centers, they just do IVF, which is not right. A lot of them do it, but again, we should not generalize. So
that's where CIFAR is different, is what you're saying. The care factor आपने कहा, which was missing in one of the places that left their patients stranded, is what you're saying.
Yeah.
So if there is a bad diagnosis, okay, and then you don't have a lot of hope. So the worst cases will go towards, in a way, you're saying IVF, and then furthermore research and then interventions, etc. Right?
I would not say worst cases, because there is a terminology called as unexplained infertility, Rahul, where we do not find any concerns or any problems in any of the reports.
Okay.
But still something is not happening rightly, and we class it as, which is responsible for 25% of our patients who come to us. So
25% of the patients you don't know.
No, I mean, sometimes
the reason for their infertility.
Yeah, so we do put down to stress, anxiety, and all that stuff. But as such, the blood
Bhagwan ko मालूम
markers,
उसका reason.
right? So they are not like worse. Maybe it's just the stress which comes in, or the lifestyle, even though we try to improve it. But sometimes, that subconscious level is much, much stronger than what your outward personality is. So I still feel they're not worst cases, but sometimes I feel that they are the ones who kind of take forward IVF as an option, because it's just not moving, and they're trying their best. Pregnancy not happening brings in that extra stress. So they're already stressful, and then extra stress comes in. So I feel that for them, IVF at the right time is a better option as well. So maybe they're not the worst of the cases, but it's just science hasn't been able to find.
Lifestyle.
Yeah, so that could
अभी
be
मुझे
also.
कुछ नहीं करना है, career पे focus करना है.
Yeah.
But आपके हिसाब से ideal age of getting married is?
Oh my God, I don't know. I mean, 27, 28.
24 से 34 तक तो बच्चे
I
करने हैं,
think
तो उससे
27,
आसपास ही
28 में कर लेनी चाहिए.
maximum
That
है ना?
you have your kids by 30, 31 kind of a thing.
मतलब अगर आपको ये सब stress में नहीं पड़ना है.
नहीं पड़ना है तो, है ना? Because I don't know whether if you want to have 2 kids by 34, you should be able to finish ideally. Yeah. I don't know how many people will like me now, but yeah, I think that's the advice that be on time. I think that's important. Not to put stress on being on time, but
And the habits you mentioned,
That's
they're very, very important.
important,
Exercise,
yeah.
the testosterone levels in the male, don't exercise, it'll go down, and
Yeah,
things like
yeah.
those that you mentioned.
And I think what we are seeing now is that even if it's getting delayed, the female partners, the females are coming to freeze their eggs.
I was actually wanting to know this. बहुत
And this is
celebrities
the
भी
reason.
करते हैं,
This
है
is
ना?
the reason, because sometimes we have limitations. We just cannot be on the biological clock, because it's like a clock.
So you're saying time freeze कर दो
Time freeze.
for the female partner.
That's
more.
right. Yeah. Because female ovarian reserve declines. Male sperm parameters don't decline
Over time.
as kind of much as compared to females. So this recommendation is mainly for the females, or if they're married couple, then the embryos can be frozen as well. Yeah.
So then if you want to focus on your career, you can just freeze your eggs in time in a way, and then younger eggs in that sense can be utilized later.
Later on.
Right. So that's also available at CIFAR.
Yes, absolutely.
Does it cost much?
I mean, it is a freezing cost, because you're freezing it
for a duration.
So it is annual freezing cost, and procedure cost is there. You still need to stimulate the ovaries with injections. So it does come with a cost.
We leave the details in the description for CIFAR, where to contact, how to contact. It's in Gurgaon, by the way. Easy to reach location of Gurgaon as well, the Golf Coast Road. If you're looking at counseling, if you're already not having success, you can connect with CIFAR and you can go ahead and plan your journey forward towards happiness. What are the innovations that you feel are coming next?
So, see, the basic principle is fertilization, because that will make a human cell, right? A new human cell, or what we call as a cell stage of the baby is embryo. That is what it comes up with. Now, how to optimize this fertilization is you can select better quality sperms, you can activate the oocytes. So you have this oocyte activation technique. They can be used as well. Uh, Beyond that is the immunology and the genetics of reproductive health. The genetics helps you to understand the cells. So to understand the embryos, we have what we call as a pre-implantation genetic testing for abnormalities or aneuploidies, PGTA. And then for studying the endometrium or the uterus, we have this receptivity assay checks
You're
as
doing
well.
already.
We are doing as well. And then immunology is to understand that sometimes what it is believed is that, and a lot of research has
System
shown,
is
rejecting it, or maybe just not accepting it. So these two things can be gauged by certain blood tests, certain biopsies. So they are also coming up.
So quite a deep dive research that you do into your patients.
That's right. Yeah, absolutely. So that is beyond, in vitro fertilization,
IVF.
standard IVF. Yeah.
Great. What do you foresee happening in future? कि baby ही बाहर produce कर लो. Is that the future of where this is heading? ऐसा कुछ तो नहीं हो रहा है ना? ऐसा इतना कुछ radical तो नहीं होने वाला है अगले 10 सालों में.
We always read about these news from the Silicon Valley that they're making designer babies and all. But I think that's the wrong use of science. I mean, again, that's my personal opinion.
Somebody's genes put into
somewhere. You're trying to make a more designer.
What is your thought about this? Do you think this is unethical?
I think it is unethical. We're using the science in a very different way. This science was developed to to give happiness to those couples who are not being able to conceive, and going beyond that point, making designer is, I think, it's asking too much. The only thing I feel that needs to invent is that the limitation of a female body you see is declining ovarian reserve with age. If we can just make new eggs and put it into a female, I think that's what I would like.
That's the innovation you would like to see.
Because that's one of the stress factors which come in a female.
So all the research scientists around the world, please, this is one factor that you should work upon, which is how to get the female body to recreate more cells, is what Dr. Puneet is suggesting to kind of address the concern and issue.
Because we are still doing some work on it, like PRPs and stem cells, but they're not like definitive treatments. So something more definitive treatment is what I hope and look for in the future.
JOAAT-Casts cannot end without having a fun ending to it, right? And getting to know Dr. Puneet a little more. You have to qualify some statements as either a complete truth or a myth, ऐसे ही बोले जा रहे, or a grey area. So the first one is, infertility is mostly a woman's problem.
Myth.
Yeah?
Yes.
Could be
it's
either,
completely myth, and that's what I have been trying to do for the last 10 years, breaking this myth. Yes.
Okay. Lifestyle impacts fertility more than people think.
Gray area. Because people are now thinking that's the main cause. Because, when they come to me, they don't ask me, what is my problem? They ask me, what lifestyle changes can I do to make my fertility better? So that's the first question. So I think I would say gray area.
People are
coming forward for it. Yeah.
Stress alone can cause infertility.
Myth.
Yeah, myth.
Not alone. Yeah, stress one of the factors, but not alone. Yeah.
Right. IVF guarantees pregnancy.
No, it's a myth. Complete myth. I mean, we do have good success rates, but still we don't guarantee. It's a science.
4,425 and counting.
Yes.
In 5 years. So it's almost like 3 pregnancies a day. That's the impact CIFAR has had. Frozen embryos work as well as the fresh embryos.
Yeah, truth, I would say. Because freezing technology has gone very, very far ahead and very successful. So we use a method called as vitrification. Yes, so it's true, I would say. Yes.
Okay. Egg freezing at 40 works as well as egg freezing at 30.
No.
No? You said with age, that's a
Age that
big factor.
declines.
Hai na?
Yeah, the better at the earlier age you do, the better it is.
Earlier increasing is
But
better.
don't put yourself off also if you haven't thought about it and you're thinking at 40. Not to put away, I mean, what exactly, if I talk a little bit about science here, to get good quality eggs, we need to stimulate the ovaries. So what we call it a stimulation cycle. So if you're 30, you maybe just need one stimulation cycle to get good quality eggs. At 40, you maybe need 2-3 stimulation cycles to get that same number of eggs as of 30 years.
Great information we are getting even from the game. Okay, couples are waiting too long to seek help. Is that a truth?
Yes, I would say so. So it has again. This is a trend change now. When I started practice, it was true. Now I would say it's a gray zone.
Okay. Yeah. So people are coming forward.
Coming forward now, asking and speaking
more
about it.
consciously.
Yes, yes.
Urban India has overcome infertility stigma.
Not gray zone, I would say.
Gray zone.
Some, it's a mixed pattern. Some of them are very open. Like a small example I'll give you. You know, when a couple gets pregnant with us, we give them like a gratitude, a thank you and all, and we also ask them to put review for us. Not all of them agree to put a review because they don't want to tell that they've undergone this treatment.
Very interesting on this one. Huh? IVF babies are less healthy. Myth, just in general. Do you feel that they're treated differently or the doctors think of them differently? Acha, IVF baby kuch to hoga hi.
Not really. I think there's enough research and data around now in the literature that among the doctor fraternity, they are not kind of outclassed or anything.
Yeah. So IVF babies are there's
equally,
no difference.
Yeah, they are equally as good as natural conceptions. Yes.
Male infertility is rising. Your research, what does that tell you?
I would say true.
True.
And I don't know whether we discussed before that I think it's also the lifestyle and all, but also it is coming forward. Initially, like I said, the males would not come forward to get them tested. Now they are asking for analysis and testing. So it's just because we are seeing more. Maybe it's getting more diagnosed now. It was not maybe diagnosed that much. So yes, little bit rising, but also we see a higher trend because of the diagnosis. Yeah.
पहले आ ही नहीं रहे थे
आ ही
सामने,
नहीं
तो
रहे थे.
we would not know the benchmark,
That's right.
the baseline for it was.
Absolutely.
Okay.
Yeah.
Diet can improve fertility outcomes.
A gray zone, not on its own. You should not just rely on the diet. I would say that investigations just to make sure that everything has been ruled out, then diet can play a role.
Then it can.
Yeah.
Okay, so that was game 1.
Okay.
Now we have one more game, okay? But before that, if you were not a doctor, what would you want to be?
Like I said, 2 things which I have a desire is, like, in fact, 3 things is a little bit more knowledge of tech. I still feel that I need a dancer. I'm not a dancer, but I love to dance. I want to learn dance. I don't get time, but I want to learn if given a choice. And third is that I want to understand Gurbani, which is like Guru Granth Sahib. So I would go into either of these 3 parts in case I stop practicing any day. I think last 2 are maybe pursuing my passion of dance and understanding Gurbani. So
are you religious in general?
I am.
Very interesting. You're religious and you think Gurbani ko understand karna. Nice. This game, what I'm going to play with you, it's called Clinic Time Machine. Okay? If I put you in a particular year and then I'll give you a scenario. 2000, your first day as a doctor. Was it 2000? 98, 99?
98.
98, yeah. Your first day as a doctor. What advice would you give to your younger self?
To my younger self? Oh
when
my
you
God.
were there on the first day. Now
I wish I would have been more clever like what I am today.
Clever?
Yeah.
So you were not clever, is what
I was not. I don't think
clever.
so.
You're a doctor.
I think clever about that is knowledgeable. I was knowledgeable, but understanding the world, I had less knowledge. What I feel is that understanding the body language and the way people act around
perceptive.
Yes, maybe more perceptive than that time. I was not perceptive.
So you would be like, मेरा हाथ टूटा हुआ है, हाँ तो टूटा तो है, मैं पट्टी लगा देती हूँ, चले जाओ types. Or you were not the empathy.
Yes.
I think that was
So I think empathy.
something you've learned.
Yes, I would say maybe the empathy bit. Yeah, because you're not started practicing yet. A little less, empathetic. Yeah.
That would be a new doctor on the first day. That's the lesson that you want to give now.
Nah.
Okay, time jump 2. We'll come to the next time jump.
Okay.
2003, I think you finished your MS.
Yeah.
You know?
Yeah.
Okay. So, what would you tell that version of yourself about the life ahead after the MS?
Oh my God. Okay. You're putting me on a spot now, Rahul, right?
You have to be faster.
Okay. Right. So, again, I think I wanted to go out of Rajasthan and study. Yes, like I said, overseas was one of them. If not, I would have come to maybe Delhi, Bombay, places and got exposure. But I think I would have been a little bit more firm and said, no, it's UK. I need to be. I was not firm maybe that time.
Not sure at that
Not
time.
sure. Maybe just a little bit more sure about the Western education.
So you would coach your earlier version to say, ki, bhai, karo, go ahead.
Go ahead.
Do it.
Yes, yes.
Something like the leap of faith you took and you came back afterwards. And time jump 3. Okay. NHS, St. Mary's, UK, that range. Huh? So, any specific lesson that the NHS and the St. Mary's journey gave you which shaped your Indian practice?
There are a lot many things, I would say. NHS shaped me. I do owe a lot, I would say. Again, what I learned from St. Mary's was we used to have like patient review meetings every Tuesday. So those I have still inculcated in my practice here. We do have review meetings every
patient review meeting with the patient or with your staff?
So we see first with the staff and then we would call the patients. And patients who have not been successful in this journey with us, we would review their case as a team with everybody.
What we could have done differently.
What we could have done differently, and in case they plan to go ahead next time with us, what can we do? And then we discuss the plan. If they try, and then we discuss that plan with the patient. We bring them back and we discuss with them. That's something I would say that I've really learned. Reflecting on what it's not only being happy on being successful, but also trying to make sure that how we can have more better success rates. Learning from
did not work
well. Yeah.
Time jump 4. The day that you decided to build CIFAR. Okay. Was there any fear, any hope of taking this leap? What was it like for you?
I have been a very clinical person, Rahul. Very clinical person. So my only fear was management, because I don't think we doctors are good managers.
So when you say clinical, you mean like
practicing, seeing patients, managing their treatment, making plans, because that's what I have studied throughout my life.
Who will create the space? Who will manage the space? Light kaise chalega? Equipment fail nahi hona chahiye.
That's right.
Refrigerator should be constantly on.
Yes, hiring the right people, HR responsibilities, all these things a little scared me. But then I just dived in.
You have people to help you around.
Yes, I've got a beautiful team now who help me around and have taken those fears from me, and they manage it now.
Nice. Great lessons.
So I've learned to be a good team worker as well after CIFAR.
Care, in fact, is a big factor in anything that you want to try to do.
Yeah.
And management, I think if you add that care to managing anything, it does help.
And I think the care concept is still going on with my staff also, because if we care for them, they give good care to our patients. So it's all that atmosphere of, again, patient-centric approach where it's care. So my staff is also taught every day about these things, care, empathy, sympathy with our patients. So I think that has been not only with the patients now, but everybody around working for me here, they have been of the same now mindset.
Built their mindset.
Yeah.
Okay, time jump 5. Future you, 10 years later. What do you hope to achieve and say thanks to yourself?
Thanks, I would say first that thanks, I took that decision of opening CIFAR. I don't think so far, touch wood, by God's grace, any regrets. I'm happy with this journey because I'm being able to offer patients what they need. Right? That's been, and that was the whole logic of opening this, that patients don't get lost by the decisions made by somebody else, right? So I'm very much in their decisions, and I support their decisions, and I'm a part of it. So that's something I'll always be proud of. And where do I see myself? I see myself, I think, practicing and helping these couples with my maybe white hair. Yes. But yeah, like any day, if I stop practice, I'll pursue my passion and hobbies. But yes.
Imagining doctor dancing.
Yeah. But I would see myself just practicing. And a lot of my patients do ask, do I have CIFAR anywhere else in India? So maybe just where I feel that it's lacking, I may try to build up one or more CIFAR there, where I feel these services are still not there.
This is the only center person.
Yes,
currently.
yes, that's right.
You're planning to expand?
I think not now. We are focusing here only.
Rapid expansion might lead to reduction of care.
Yeah, that's right. So no thoughts yet, but yes, maybe if you ask 10 years down the line, I don't know if things change, I may consider that.
You have other doctors working with you as well now?
I have a team of a doctor and my staff, 2 doctors and my staff. But obviously the idea was led by me, but then they support me in all my ventures and services, whatever I do.
If you were a patient walking into CIFAR, what would you want to hear from your doctor?
I would like my doctor to hear me rather than they speaking. I would, because I am here for a reason, to get my treatment and maybe what I've gone through. So I want my doctor to be a good listener. That's what, obviously, good in their clinical knowledge and skills, no doubt. That's why I'm coming to CIFAR. But I would like them to listen to me.
Yeah. Great answer. We'll just come towards the human behind the doctor.
Okay.
So with Dr. Raman, you have 2 kids.
Yes.
Yeah. And what do you do to spend that family time? What's the most important activity that you guys do together?
We have made sure that we take 2 holidays in a year. Generally, it's like June and December.
Oh, okay.
We try to be together at least for a week, 10 days, and that's just the family time. I try to hand over the work here to my other doctor, and yeah, that's our time.
That's how you let off steam. Do you ever feel emotional burnout?
I do feel, Rahul. I think, and that's
so we've spoken about this success, right? There's also a lot of disappointments.
So the days, when we get unexpected results, that day I do feel, I think sometimes I feel that's good because I am with my patients, as I am equally troubled by their
How do you manage that? Because it's a huge number of patients who walk in every day, right? Even though you have almost 3 success stories a day in the last 5 years, almost, maybe more than that, right? But how do you manage that situation at least?
So, again, it is like for me, and I think it's for the staff also. Like I said, the whole team gets involved in the patient care. They also get affected. So, and I think I feel that it's my responsibility to keep them elated as well. So we keep on doing those staff engagement sessions, and doing small games with them, making them understand, life has a meaning. Everything has a meaning in life. Maybe this has happened for a reason. So we try to kind of a little go in a more spiritual way. And myself, how do I kind of unwind this? I think I go home, talk to my husband. I feel quite, because every unsuccessful event, he's aware about it. Maybe successful event, he may not know, but unsuccessful. And I think that's why sharing has been very integral part of my unwinding thing. And that's why when I said what I would like if I'm a patient is I'd want to open up, right? And I think the other person should be a good listener, comfortable. Yeah.
Very nice, beautiful. So with that, we've come to the end of this JOAAT-Cast. But I'm very thankful to Dr. Puneet Rana Arora for taking out so much time and talking to me about everything that CIFAR does and how they've brought happiness to 4,425 people and counting. So a huge thank you, Dr. Puneet. I hope you enjoyed. as
I
much
thoroughly
the
enjoyed that.
conversation.
I didn't know what the questions were coming on, obviously, and you had kept them, like, put me on a spot and made me think and reflect back.
Yeah.
So thank you so much for that. I felt I never had such a cozy conversation. I've let myself out, and that's
I have
what
an
I
achievement.
love. That's what I love doing as well. So thank you so much for having me here.
Yeah.
Thank you.
Brilliant. All right, so that's Dr. Puneet with CIFAR. It's in Gurgaon, and I'll leave the details in the description so that you can contact and connect if you have further questions or you are interested in any such treatments. The next time, I have a story of somebody who's created a company for inclusion, for adding people with disability into the groove of working and functioning. And they've also been awarded by the President of India. Stay subscribed and keep watching the JOAAT-Casts.
Thank you.
See you.
See you.
Bye.
Bye.